Hadassah is the major hospital in Israel. When you have a problem, a medical problem, you come to Hadassah. It's not just the hospital in Jerusalem, it's not just a hospital for the citizens of Jerusalem. This is the leading medical center for the citizens of Israel. So this is one point, to be able to support a hospital which will be able to give any treatment to any patient in Israel at the highest level possible. Secondly, Hadassah is a major hospital in Israel that invests in research in biotechnology. And as you all know, research is not just for the benefit of the citizen of Jerusalem or Israel. From our research, the benefit can be worldwide. We are involved in stem cell research, which will affect many people. We involved in cancer research. We involved in infertility research. We involved in gene therapy research. So these are the two major components that when you sit back home outside Israel and you look into a project in Israel, so no question that Hadassah has a major role in the Israeli healthcare system.
I'm Dr. Marzouka. I'm a Palestinian cardiac surgeon. I'm living in the Palestinian territories, in Bethlehem specifically, and I'm been working here in Hadassah for the last 3 years. We are dealing with all patients independently of their religion, race, color, anything, and everybody here is doing his best or a bit more than his best to help the patients, and I think this is one of the secrets of the success of the management of the patients in this hospital.
We see ourselves as doctors, and that's our job, and it's probably a major bridge to peace, the fact that we're able to take care of people from both sides equally. You may know the story of my late brother, who was murdered on the way home from Hadassah about 5 years ago this February. He was a hematologist. After treating patients on the last day that he was alive, the last patient he saw was an Arab woman from a village next door where he lives in the in the West Bank. So that's actually a very tragic story, both for me personally and for Hadassah, but it epitomizes the way we try to do our best to take care of patients despite the very tragic conditions that we live in at the moment.
Hadassah is not only a resource for Jerusalem and the nation, but it's an international resource. It's a referral center for people with complicated problems from the whole region.
At Hadassah, at the Department of Bone Marrow Transplantation and Cancer Immunotherapy, we are in a position to offer several treatment options that are not available in the UK or anywhere else in the world.
This is the Hadassah Pediatric Intensive Care Unit, and this is most of the unit. There's some on the back of us. And this young child here is David Primov, who flew to us from Baku, Azerbaijan, and he was born with a congenital heart defect, which went unoperated or untreated actually for years. And now the community decided to help the family to have him have a corrective operation. He was operated on yesterday, and he's making progress according to what we expect.
I think that Hadassah is a unique hospital in Israel for sure, because of the great support of research in Hadassah as a clinical hospital.
the intensive care unit deals with very premature babies usually, sometimes with birth weight below 2 pounds or sometimes around 1 pound, that have many problems and are in a life-threatening conditions. We definitely, for the same number of babies, we definitely have to double the space of the unit and have other facilities that we don't have here. A nursing station, an isolation area, a parental lounge, an isolated area for the unit, which we don't have now. We are just at the entrance to the Department of Pediatrics. We do hope that within 6 months a new location will be ready to accept us, and we'll definitely have improved conditions for treatment.
My baby Naama born last Thursday. She's now 5 days old. She born in my 26th week of my pregnancy. She's my first baby, and she was weight 885 grams, and now she's 780 grams. And I hope she will be fine. She's very strong. She's living by herself since she is born, and I hope everything will continue to be fine.
Every one of us here love the babies, and you know, some of us have special ones that we like to take care of each day, and you know, sometimes they're here for months. I mean, we have one baby here for 6 months, and you know, they're like family, and it's much more than just giving the care of the machinery. It's also the care, emotional care that we give a lot to. That's the best part of it.
I'm very thankful to God and to the people who take care of my grandchild. She's my first, and we hope that you will survive and be strong enough to feel all the love around her. And it's very good to know that he's in a very good hands.
Hadassah does important work both for Jewish and non-Jewish people, children. It's a humanitarian organization that gives, and I think the message I want to give to the people in the UK is also, if they can give, then it would be very important.
When I was a medical student, I was always sort of amazed or even embarrassed that every time I'd be in on a lay down on a birth, I would cry. It's an extremely emotional moment. Every parent knows that. I'm a parent, I've experienced that myself, but somebody else's baby, well, it happens. You can't explain it. You do have those moments in this field. After surgery for Parkinson's disease, the patient will come back, let's say a week or 2 weeks later, and they will have their first programming session. So the neurologist now, that we've managed to recruit to the team, he will program the pacemaker that sits here under the skin, and after playing around with this for about an hour or an hour and a half, he'll find the correct parameters for the stimulation, and suddenly the patient who was previously frozen and tremoring can suddenly stand up, walk. And this was, I mean, it's always a very dramatic moment, and they can't believe it, and their spouse can't believe it. And we're beginning to believe it ourselves a little bit more, but it happens every single time.
It's like my home, of course, because I come all the time. When they ask me where you like to go, which hospital, I say Hadassah.
Put it this way, if the whole world worked like Hadassah, everything would be wonderful.
I feel very proud to serve as a Director General of Hadassah. But not just proud, I feel the responsibility. Because when you look back and you see the role of Hadassah, and you would like to develop Hadassah for the future, it's not enough just to feel proud. And this responsibility brings me to you as well, because we need all the support to keep Hadassah as a hospital that serves as bridge to peace to be at the level that dignitaries from all over the world come to see what's happening in Hadassah, to be able to be in a position to be nominated for the Nobel Peace Prize. All this brings us a lot of pride, but a lot of responsibility.
It's a triple-pronged project. I mean, if you support Hadassah, you'll be supporting Center of Excellence of Medicine, you'll be supporting peace, you'll be supporting the essence of Israel, in fact. And I think it's a very worthy cause.
Whoever is supporting us to have citizens with better health perspective, and it's a big and great service to the nation.
Then there are the patients who, without fail, will call up every Erev Chag to say, I don't have my pain anymore, and I don't know how to thank you enough. Of course, it's not me, I was just the intermediary, but these are very dramatic moments, and it makes us realize how much patients need these procedures, how much they need us as a team, and what a big difference it really does make in their lives.
For me, the one memory is a very recent one. Being in the emergency room, see a patient at the age of 45 comes with stroke in the brain, can't talk, can't move his hand and arm, and knowing that in any other hospital he would have been sent to rehabilitation. But here in Hadassah, we took him to our neuroradiology invasive service. And with catheter to the brain, we treated him. And on the table, he started to talk and to move his leg and hand. This is, for me, Hadassah.